Good morning, everybody. Thank you so much for joining URL and UHC for our Carrier Connection webinar today. So the month of March, we've been bringing on all our carrier partners to go over their benefits, any marketing or sales techniques, and kind of any little nuggets of information that they have to share with you. We've been recording all of these webinars. They are on our training center on our website, so feel free to go there and watch anything that we've done in the past. And I think we've been doing 2 a week every week, so go to our event calendar and register for any of them that we have up and coming. And then in the month of April, I'm actually doing a Build Your Agency set of webinars, so feel free to register for those as well when you're out there checking out what we've done. You are very blessed today. We have the whole UHC team here to talk to you and teach you. So I'm not going to waste any more of your time. Oh, really quickly, I did want to tell you this with this new webinar platform. If you want to just go ahead and click on the blue chat box on your bottom right corner, it's going to open up a chat that is public. Everybody will see it. And then there are Q&A as well. So if you have a question during the presentation, just go ahead and type it in there. If you want to chat with everybody public, that's where you do it as well. And there's handouts in that section for you too. So just keep that up while we go through the slides today and enjoy. I'll give it to you, Andy.
Thank you so much. And good morning, URL team. It's a pleasure to be with all of you today. And I want to introduce myself. I'm Andy Bird. I'm the virtual market sales manager for East Pennsylvania and also Delaware. And we've got our whole team here except for our director. And our Delaware market sales manager is having to fill in at another meeting. But just want to introduce all of our team. So our director is Joe Johnson. And we also have Miriam Figueroa, who is a market sales manager for East PA. And next is Julie Slusar, who is also market sales manager for East PA. And then Erin Bailey is also market sales manager for East PA. And we're missing, again, Joe Johnson today, and then our market sales manager for Delaware, who is Terry Bacot. So we appreciate the opportunity to share with all of you today. So we're going to jump right into the information because we know we have a 1-hour time limit. So we want to talk to you today about the difference that UnitedHealthcare makes, and we make a huge difference. And we want to talk about the Eastern Pennsylvania and Delaware Medicare Advantage portfolio. And we first want to talk about the agent experience for all of you, and how does that help you? So first of all, you can earn even more money this year on health assessments. You have more earning power. The payment for completing a health assessment for any 2023 Medicare Advantage plan, which includes D-SNP plans or C-SNP plans or regular MA plans, that health assessment payment is $75, and that was up $25 from 2022. We've also made it easier to get that money by opening up Sunfire and Connecture and also My Medicare Bot, meaning that agents who use those platforms to enroll a member can do the health assessment in that same platform as well. So it makes it very easy for you. We also have better technology tools. We've made improvements to the tools that you use. And within our main resource that we call Jarvis, you are able to act on behalf of the member to order a new ID card, change a PCP. There are new mobile notifications and book of business access. We've also added the approved date to enrollment applications, and our enrollment application, which is called Lean, will have a certification check to prevent you from submitting enrollments for plans that you're not certified to sell. Our certification process was also simplified to make it easier for you to find the certifications and know what's required, and then to streamline the application entry. Scope of appointment pre-populates into an application. We also have a producer help desk, which is available for you to take your call, and we've made that even better. We've increased PhD staffing, including a new escalation team that's focused on getting issues addressed faster. For those that are new to selling UnitedHealthcare, there's the new Agent Success Program, and that's designed to help increase new agent productivity by helping you get started and maintain growth trend into year 2 and beyond. This includes some targeted training, some specialized best practices support from our producer help desk. It's available for new agents who have sold 3 or more apps. And for those of you who are premier agents, we've added priority queue routing for chat, and that's in line with our priority telephone queue. Our agent materials are outstanding. We're continually updating those materials all the time. We're really proud of our UnitedHealthcare toolkit. This has materials for all products, including non-SNP and also SNP materials. There's a lot of things that in there a lot of materials you can order actually free that'll help you, or very low cost at least. The enrollment guides, also the service area is back on the front of the enrollment guide, and we've also removed the plan year and a plan description to help free up some space. Our training and resources, we believe, is second to none. So you can also go to Learning Lab within Jarvis, look for new training. Again, they're constantly updating that all the time. There's live training, there's self-guided training that's available to help you develop and grow your business. So want to talk to you a little bit at this point about the difference that UnitedHealthcare makes. I've already been talking about that somewhat, but let's talk about some more stats here that'll enlighten you. So before we get into the various plan benefits, let's review some of this information here. I think you'll be pleased with this. UnitedHealthcare has a nationally recognized brand. We offer a national footprint of Medicare products, including Medicare Advantage, Medicare Supplement, and standalone Part D plans. We're proud still to be the industry leader in market share for both MA and Med Sup. Now, I believe this would apply to most of you. When you want to be part of a team, part of a winning team, not a losing team. I've been on losing teams before. It's no fun, right? Winning teams, it's great, but you also have to continue to win, and that's what we're doing. So when you are part of UnitedHealthcare and offering our products, you get the winning team with UnitedHealthcare. There are more people, over 13 million, that choose UnitedHealthcare Medicare plans than any other company. And there's a reason for that. We really believe in our hearts, and we really mean it when we say that we take care of our members. Our plans also have the backing of a Fortune 5 company. We are the only carrier that offers MA, PDP, and MedSup plans that carry the AARP brand name, and that's important to a lot of people. We've been recognized by Fortune as one of the world's most admired companies for the 12th consecutive year. I like to say that's outstanding if you get recognized in that way for 1 or 2 years or 3 years consecutively. This is our 12th consecutive year. So what does all this mean? It means that when you put your members with UnitedHealthcare, you can feel confident that they are backed by a company that will take care of them. For us, it's more than just the benefits. We know the benefits are important, but it's the entire package that you get with UnitedHealthcare. Our leadership position, our experience in the industry means that we understand Medicare. So at this point, I'm going to turn it over to my colleague, Julie Slusar, and she's going to share with you some more great information.
Hello, everyone, again. Thanks for joining us. We're going to get right into all of the exciting things that UnitedHealthcare is doing with Medicare Advantage plans this year. So along with all of the improvements to the agent experience that Andy just talked about, one of the things that UnitedHealthcare is really excited about is all the improvements and then the investments they've made into member benefits. Over 90% of our members are going to see improved benefits this year. So it's really exciting. So really, what does that mean? means more $0 care and more $0 prescriptions, an improvement to our dental benefit and our OTC benefit and our healthy food, and of course, greater flexibility for our members to use those benefits and to utilize those. First up, we have our dental benefit. This is really just something that we just are really excited about this year. We have made a significant investment into our dental benefit, but not only that, we have led the industry in simplifying the dental benefit. We have collapsed all 5 levels into one level, making it so much easier for our members to understand and for you guys to sell. So what does that mean? It means every year, our member will receive an annual benefit, first dollar that they will know what they have to spend on dental procedures, such as cavity fillings and cleanings. And now we have extractions and dentures and implants. So really exciting news. So not only that, we have down-tiered 5 prescriptions specific for dental procedures to a tier 1, which will eliminate their copay, again, saving them money in the end. And the only thing that benefit doesn't cover, of course, is cosmetic dentistry. Next up, we have our vision and our hearing benefit. 92% of our members will receive an annual eyewear benefit. And that improvement is over years past where it has been every 2 years. And our hearing benefit, our non-stint members will have a $175 copay per hearing aid. That is down by $200 a hearing aid with a savings of $400 a year. Our D-SNP members will receive a $350 allowance towards hearing aids annually. And next up, we have our flex benefit. This is new. 2 of our plans have this flex benefit. Now, what this flex benefit is anything Medicare approved for your dental, your vision, or hearing services can be used towards paying things such as your copays, or you have a dental benefit completed and you've used your annual benefit, and then you have this on top of it to help pay for those things. And again, such things as sunglasses and prescription sunglasses and contacts. So again, some great benefits that UnitedHealthcare has really invested in improving this year. And with that, I want to hand it off to Miriam.
Thanks, Julie. There is a lot of exciting things going on with UnitedHealthcare that we are so proud to be here just telling you all about it. And of course, one of the things is the U card. Now, here it says introducing the U card. Maybe it's a reintroduction for some of you who already know a little bit about the U card. But if you're brand new to the U card, welcome to the U card experience. Now, in the past, members used to have an over-the-counter card, and they used to have their member ID. What this is now, it is those 2 cards married together. So now it makes it easier for the member to have that card, to retain that card, and it makes it easier for you to explain that card. So what are some of the things that this card does? Well, the member can still use it for prescription drugs, for their dental, and they can still use the same card when they go to their doctor. The difference comes is when they go to shop for over-the-counter or healthy foods. Even though you don't see it here, what they do is they have that card, and if they flip that card over, there is a barcode in the back of that card, and all they need to do is have it scanned. So how does that look like? Well, the member will go shopping, get all their healthy foods, over-the-counter items, go to the countertop, and have everything scanned first, and then have that card scanned right after. That is very important to understand, but it's simple. It really is simple. And we are so excited to be able to introduce to you that the new way for your members to utilize that card. Now, you might be asking me, Miriam, where can they use that card? Well, across the nation, there's 55,000 stores that they can use, which is nice because, as you have heard before, our cards can travel with our member, which is it's really a nice benefit for our members that like to go to places like Texas or Florida. But if you're talking just PA, there is now Walmart can accept those cards. Several of our giants can accept those cards, Walgreens. And now coming in 2023, Dollar General will also be accepting those cards. So it makes it that much easier for your members to go shopping with the U card. And Renew Active. Now, if you know anything about the Renew Active, you know that members can go to a gym in the morning. They can go to the YMCA, or in the evening, they want to go to another gym. Like I call it the purple gym, but it's Planet Fitness. They can go to Planet Fitness to meet some friends. And so that's the nice thing about Renew Active and the flexibility. But the beauty of the U card is that they can actually use that same card. And what did I say? The back has a barcode. It will get scanned and in they go to enjoy their time at the gym. So once again, it's just very flexible. Another way that they can use it is with their rewards. Their rewards will be loaded into that card so that they can once again utilize those rewards very simply. Now, some of you might be asking yourself, now, Miriam, how can that member know where to pull or where to see how many rewards they have or how much money do they have loaded up in their card? Well, it's simple. There's two ways for that member to know. If they download the app on the phone, which obviously, or I'm going to tell you, or advise you that you can help those members do that. That just gives you a value add for that member if you can do that for them. And that information, if they have a smartphone and you load it up for them, they would have that information right in their card, right in their phone, on their fingertips to see, how many rewards and how much money do they have when they go shopping for over the counter. Another thing they can also utilize it for their DSNP members is also to see how much money they have for utilities, for something like that. So there's so many uses with the U card that now our members can take advantage of and that you can actually help them with. The other way is through the internet. If they have an iPad or a notebook, we know that our members are becoming a little bit more savvy with the Google search and all of that. Now with our single sign-on, it makes it easier for our members to go into their hub, into their portal to see all that information that they need. They can even find a store that way if need be. And you can also help them find a store. If you want more information on that, at the end, you'll see our contact information. Feel free to contact any of you and any of us, and we'll be more than happy to help you. So I was talking about rewards. This is the different ways that our members can actually earn rewards. I know that Andy touched upon the health assessment, and I always like to kind of talk about that again, just because it's so important for your actual members for that health assessment. So now you can see that not only are you getting paid for that health assessment, but now your member is also getting paid for that health assessment. What that does, it helps UnitedHealthcare know where is that member in the way of health. And it helps when they have their house calls come in for that person, for that nurse to know where is their health at and where can they help them. Excuse me. So it is super important. We've had situations where a house call, a nurse goes to that home and that member was in distress and they were able to call an ambulance to help that member. So I can't stress enough how important it is for us to do that health assessment so that we can know how is our new members' health and how can we help them. And this is something new that we are actually, UnitedHealthcare is piloting here in Pennsylvania. Excuse me. It is called Home Support Services. This is only with the DSNP PPO plan. And here in Eastern PA, our team likes to call it the unicorn plan, because for some people, they are like, this is unheard of. And it is. We are the first to have it out there and we're super excited about it. So with the DSNP PPO plan, you did hear me right. Now we have extra services for those members. There is pest control, and that's with a professional pest control person goes into their home and with that situation. There is companion care, either if they need help with bathing, help with getting dressed, brushing their hair, with cleaning, sweeping the floor, vacuuming, something as simple as that. Then home modifications. I always like to make a little bit of a joke with the home modifications because, you know, I've heard people say, well, what kind of modifications, Miriam? Well, no home extensions. We're not adding on a room or anything like that, but something very simple like a grab bar or raising the toilet if they need that. Anything to keep our members safe. And then there's yard maintenance, which is basically making sure that the lawn is done or even snow removal. This is just another way that UnitedHealthcare is extending help to our members that really, really need it. And we are so excited to be able to share it with you today. Now I am going to hand the baton over to Erin Bailey. Erin, it's all yours.
Thank you, Miriam, and thank you everyone for joining us both live on the webinar, and hi to everybody who is listening to this as a recording. I'm happy that URL has invited us to talk to you all today. We have a great Medicare Advantage portfolio, but we have a great Medicare portfolio as well. Today, we did want to go over the Medicare Advantage portfolio, but I wanted to remind everyone we also have the AARP Medicare supplement plan. So if you are interested in learning more about those, please definitely reach out to URL or even one of us, and we can get you information on that as well. First, I wanted to show you, if you were questioning why get appointed with UnitedHealthcare or work with URL, here is one of the reasons why we have coverage in almost all of the counties in Pennsylvania and a great relationship with URL. So if you work with us, you get lots of support with selling these great Medicare Advantage products. We are expanding as well. Year over year, we are one of the top carriers to continue to show growth across Eastern PA and Western Pennsylvania. My team, as you heard, is in the East Pennsylvania region, and we have had a lot of expansion in 2023. All of the light blue counties are new expansion counties. So we've expanded the Medicare Advantage portfolio into those light blue counties. I think it's 12 or 13 overall. But most exciting to us was to expand into Delaware County, down in the Philly 5-county area. We now have Delaware County is in our area. Over 100,000 Medicare eligibles alone in that county. So we were really excited for 2023. And there's already been that, I believe it's over 3,000 Medicare Advantage plans sold there for 2023. So we are reaching a lot of people and helping a lot of people in those counties. Very excited for our agents and our members in those areas. Now, I know this is a lot of line-by-line benefits. I know you're going to breathe a sigh of relief when I tell you I am not going to read all of these line-by-line benefits. I just wanted to give you an overview, because if you think about it, UnitedHealthcare alone has 5 to 7 Medicare Advantage plans in every county. We have a lot of offerings, a lot of plans, and then if you add in all the other carriers, it can be 70 some plan options depending on where you are in Pennsylvania. That's a lot to pick through. So let us help you. Let us and URL help you decide what plans to lead with. So in each of these little slides, I'm just going to tell you a little bit about the plan popularity and maybe why you would choose one plan over the other. If you are already appointed with UnitedHealthcare, you can access these exact documents on our website, uhcjarvis.com. I can tell you where at the end of this. And then if you are not already appointed with UnitedHealthcare or with URL, maybe you want to get in touch with URL, we can give them these documents to share with you as well. You can have some light bedtime reading. Now, first, I wanted to address the Greater Philadelphia area, otherwise known as the Philadelphia 5-county area. That is Bucks, Chester, Montgomery, Philadelphia, and new for 2023, Delaware County. So that region has their own unique set of plans, starting with 2 HMO plans. We have a $0 HMO and an HMO with a premium. No surprise, the $0 HMO is the more popular option. I believe we have almost 700 plans with the premium HMO and far more sold on the $0 HMO. So why would someone choose that HMO with a premium? Well, like I said, quite a few plans sold. They might look at the premium as a little more value with the in dental, vision, and over-the-counter benefit. If you see there's a little more benefit there, and that is why people typically go with the premium. There's also a lower inpatient hospital copay and a lower max out-of-pocket. You will see the light blue across all of these slides. So there's the dark color and the lighter blue color. Those are all improvements and investments made into the portfolio. You'll see a lot of that across the entire portfolio. 2023 was a great year for investing in those things like more ancillary dental, vision, hearing benefit, lower inpatient hospital copays, and even you'll see flat hospital copays on some of the plans as well. On to the PPO options in the Philly 5-county area. We currently have 3. That is because we had a new plan this year, the $0 PPO 3 with no medical deductible. So that, of course, was the most popular plan for 2023 so far. Lots of that PPO 3 in the Philly 5-county area was sold. And if you can see those lines there, the big one was the removal of the medical deductible. That was a big deal. People had been asking for that. So that's another reason to work with UnitedHealthcare and with URL. We really listen to your agent feedback. We are grateful for all of our many, many, many agents across the state and the members and the business that they bring us. So we listen. We know you are out there talking to people. You know what they care about. You know what their concerns are, what their health needs are. So we take that into consideration when we build these plans. So we were told it's really a barrier to have a medical deductible, and we were able to give a plan for 2023 in the Philly 5-county area, $0 premium on the PPO and no deductible. You'll see the other plan options. There's the plan 2, also $0 premium. There's a $500 medical deductible. So why would anyone choose that plan? Well, some people were happy with that plan. We had a lot of people moving this year out of that into the plan 3, but many ended up keeping plan 2. Why? Because there is some more vision on that, some more over the counter, and a lower inpatient copay. If you do the math, you'll see the copay is a flat copay on the plan 2. And it ends up being a little bit less if you're staying a full 6 days in the hospital. So if you're doing the math and you think someone might need to use that, the plan 2 ends up being a little bit of a lower cost with an inpatient hospital stay. Now the plan 1 does have a premium, and for that premium, again, you get more vision benefits, you get some more over-the-counter costs, and some other things there if you go with that. And it has been fairly popular. Again, plan 3, the $0 premium, was the most popular plan among these options, but they all did very well. Next, I'm going to talk about the rebate plan. Just trying to check here and make sure I'm on the right slide. As you can see, these are very tiny and I don't want to read through them all. This is our rebate plan. This is our new plan for 2023. There's a Part B rebate on this plan, up to $50 every single month. Now, I will point out, Julie was talking about some of the great investments across the portfolio with lower copays on the prescription drug formulary and some of the drugs that we down-tiered with the prescription drug formulary. So I did want to point out on our rebate plan, it is the only plan that does have a prescription deductible, but you do get that $50 back with the Part B rebate. On to the next. We're going to now travel outside of the Philadelphia 5-county area, and we're going to go up north to some of the other expansion counties. So we expanded up north. We're getting closer to New York with our expansion up there. We have a $0 PPO that was new in 2022, and we now have this HMO plan for 2023. Both did very well for 2023, and I bet you can't guess which one sold more. We actually had that HMO plan end up being very popular. We had more of the Flex HMO plan sold in the expansion area than the PPO. I'm not sure why, but I'm thinking people are really liking that Flex card that Julie talked about, that additional benefit they get. They get that Flex card where they have the ability to use those dollars to pay for dental, vision, and hearing copay. So it really just adds on to those ancillary benefits. Now we're going to come to my neck of the woods. I live in this area. This is what we generally call, very generic term, outside Philadelphia. Well, that's counties like Berks, Lehigh, Northampton, York, Lancaster, Dauphin. We have a fleet of PPO plans in that area. And of course, the most popular here is the Plan 3. And what is exciting about PPO Plan 3, which is a $0 premium, is the medical deductible has been removed for 2023. Again, we were listening. Even though this plan did extremely well with a medical deductible, we were able to get that approved to be removed. So this plan sold a lot in these areas. People were happy with that. It's just nice to show that there's no more barrier there. They can go when they are able to predict their costs more when you see no medical deductible. So we also have 2 other PPOs. Each one has a premium, and as the premium goes up, so do the ancillary benefits, so do the over-the-counter benefits that they get every quarter. So you can see those going up as the premium goes up. You'll also see the flat inpatient hospital stay on both the PPO 3. It's a nice flat fee. Again, it's comforting to many to know what their cost could be. So the flat inpatient hospital stay on the Plan 3, and an even lower flat hospital stay copay on the Plan 2. Two more plans to go over here. Now this is the HMO plan that is available in the outside Philadelphia area. So this is a separate Flex HMO plan. It is not the same as the one in those expansion northern counties, as we call them. Still a great plan. Now, this one is typically a $0 premium. It does vary by the level of low income subsidy, and they get that lovely Flex card along with their U card that Miriam told you about. The U card is, again, a reminder, the member ID that they can take to the store when they need to use their over-the-counter credits. When they have the Flex card benefit, this is the only time they get an extra card where they can use for dental, vision, and hearing copays. And this other plan, we just wanted to remind you, the rebate plan is not only in the Philadelphia 5-county area, it is also in what we call the outside Philadelphia area. So counties like Berks, Northampton, Lehigh, Adams, Dauphin, Lancaster, etc. This was that was the same plan as before that I told you a little bit about. We do offer one plan with no drug benefit. This is an MA only. We call it the Patriot Plan. Most carriers offer a Medicare Advantage only plan, and we do too. It is suitable for folks that do not need a prescription drug coverage, typically veterans who have other prescription drug coverage. And with these, they do get an increased Part B rebate. So the premium for Medicare Part B, they get a rebate of up to $65 with this plan, and some increased dental. We were able to bump the dental up to $2,000 benefit, and some increased ancillary with the hearing aid as well. Now, what was really dear to my heart, especially this time of year, because the dual products, the dual special needs, you can offer all year long to folks that need the extra help. We have 3 special needs plans, so 3 dual special needs plans across the state. So if you notice these counties, you notice that long list of counties there. This is available across Pennsylvania. And these are some fantastic plans. We've been selling a lot of these. A lot of people need help, and we are happy that we can offer something to them to help them out, because it's not just about your your body for your health. It's about your financial stability and a lot of other things like getting socially connected. We offer that with the Renew Active membership. All of these plans have the Renew Active by UHC. They can go to the gym, they can socialize, they can go to the YMCA, and then these dual plans provide some extra stability with the food dollars. So the healthy food credits are combined with the over-the-counter dollars and the potential to pay utility bills like Miriam was telling you about. Now you can see it right here in print for our full dual. It's an HMO that is offered across the state. They have up to $4,000 they can use for their dental and $200 per month on that U card. Dollars, again, they can use, take their U card to the store, to Walmart, to Dollar General, to CVS. They can get healthy foods with it. They can buy over-the-counter products, toothpaste, mouthwash, Tylenol, different pain relievers, or they could use it to cover some utility bills. They also get transportation benefits, the meal benefit, which, by the way, they can use their healthy food dollars to buy those meals. They don't always, they do get those meals if they have an inpatient hospital stay, but they can also purchase them outside of that using their $200 a month. We also, new for 2023, we have a new PPO. So the dual special needs PPO means they do not have to stay in network. This is a brand new plan, and we did end up having some great business come into this plan. They can take the PPO to any provider that accepts Medicare, and we are told that it's been doing quite well. They do have the home support services credit on this plan. So this is the only plan. It's a pilot. It's really exciting to have that pilot. People are using it. They're taking their home support dollars and getting things like pest control and help in the home. And that credit is amazing. It's $150 per quarter, but that is the one thing that they can actually save up if they're doing some home modifications or saving up for maybe a week of yard care or something like that. They can actually roll over those credits and save them. They just have to use them by the end of the year. This is different from the monthly amount they get on the U card that will expire month to month. And that's really why we tell you all of it. I know it's a lot of information, but we tell you so you can better serve your clients. You want to remind them, and it's a reason for you to reach out, right? The more you reach out and stay connected with the clients you have, the more loyal they will be to you. They will trust you as a resource. So if you're reaching out to remind them, hey, did you use your U-Card dollars? Can I help you use them? And if you don't know how to use them, ask us, ask URL. We can help you help them. We want them to use those benefits because you would be surprised how many people leave those dollars on the table. And we don't want that. That's why we build them into the plan to be used. And we tell you and we educate you so that you can help your clients and make sure they take advantage of all of those extras that come with these plans. We have one more dual special needs plan that I wanted to tell you about. It is a select plan, which means it is a partial Medicaid plan. So typically, if someone makes a little too much or doesn't qualify for full Medicaid benefits with the state, maybe they just get their Part B premium paid, their Medicare Part B premium paid, but they don't have full Medicaid, they would qualify for this partial dual special needs plan. It is richer than a typical Medicare Advantage plan. It's got some extra over-the-counter dollars, some extra dental that some of the other portfolio plans don't have. So we do have this as an option for someone that makes just a little bit too much for full Medicaid. This is also a great option for them. It helps a lot of people, and it's been doing very well across the state. I'm now going to hand it back over to Andy. He's going to talk to you about Delaware, but I just hope that you have seen that really in East PA and in Delaware, there is a Medicare plan option for everyone, for every lifestyle, every budget, every health need. I know we didn't talk MedSup, but if you want to learn more about that, you can reach out to us or URL, and they will be able to get you some more information on those portfolio plans as well. Andy? Tell us about Delaware.
Thank you, Erin. I appreciate that. And we're going to share some information about the great plans that we have available in Delaware as well. Erin did a great job in providing some wonderful information about our plans for Eastern Pennsylvania. So let's talk a little bit about the plans for Delaware. So our Medicare Advantage HMO and PPO Plan 1 did not change very much from 2022, but there are a few nice differences. First of all, there is first dollar coverage for our dental benefit. Both of these plans have $1,000 worth of coverage, but again, it's first dollar coverage. There's also increased hearing aid coverage on both of our existing plans. There's increased over-the-counter debit card amount in the amount of $60 per quarter. And then the wonderful benefit of the post-discharge meals when one of our members is in the hospital, gets discharged, they get the 28 meals over 14 days, and that's now unlimited the number of meals per year. What I mean by that is it's 28 meals over 14 days, but if they go into the hospital several times during the course of 1 year, with every post-discharge, they're eligible to get another 28 days worth of 14 days worth of 28 meals. So that is a tremendous benefit because we've learned through some research from Mom's Meals that helps provide this for our plans, is that when these people get these nutritious meals and it's designed according to their health condition, that they actually they don't have to go back to the hospital as often. They don't have to go back to the emergency room. I mean, the reduction is like by at least a third. They don't have to go back to the emergency room. They don't have to be readmitted to the hospital, just simply from getting the proper nutrition that they need. That's designed by in coordination with their doctors and nurses, and it helps them to continue to recover and to be healthy and get back on their feet and be strong again. So that's a tremendous benefit. I've learned a whole lot more about that in recent weeks, and I love that part of it. And then we were also proud to roll out for 2023 our new PPO Choice Plan 2, and that is a $29 premium, but it has a $0 PCP copay and only a $20 specialist copay. It also, for dental coverage, has $0 copay and $1,500 in dental coverage. And again, that's first dollar coverage. In other words, it's not 50-50. It's first dollar coverage, and you see that through all of our plans. The eyewear benefit is at $200 per year, not every other year, and it has great hearing aid coverage as well. And also, as I was talking about with our other two plans, it has the post-discharge meals, again, 28 meals over 14 days, and that's for unlimited times per year. So that's a tremendous benefit. And then those are our three main plans for Delaware. And then we also have the MA only plan. And want to share a little bit of information about this. This is our Medicare Advantage Patriot plan. Again, MA only. It has a Part B rebate of $65. It has $0 premium and has a $295 one copay for hospital stay. $295, one copay for a hospital stay. For the dental coverage with this plan, it's $2,000. Again, first dollar coverage. There's also increased hearing aid coverage with this plan. The vision coverage for this plan is $200 per year. Again, not every other year, just per year. And the over-the-counter benefit is $60 per quarter. The post-discharge meals, again, 28 meals over 14 days for an unlimited number of times per year. Next, I want to talk to you about our dual plan in Delaware. This is our complete dual plan. And the full Delaware plan has a $0 premium. It has $0 prescription copays and has $3,000 in first dollar dental coverage. The vision coverage with this plan is $350 per year. It has $1,100 for hearing aids per year. There's $175 per month benefit for healthy food, over the counter, or utility cost. And that's a huge help for our D-SNP population. Again, it has the mom's meals post-discharge benefit of 28 meals to cover 14 days for an unlimited number of times per year. And then with the transportation with this plan, it's 36 one-way trips to approved locations, as well as the Medicaid reimbursement for buses, Ubers, mileage reimbursement for family. It's important to make sure that your clients know the added benefits that they also get from Medicaid. And then we have our dual select or our partial dual plan for Delaware, also a $0 premium, has a $250 hospital copay per stay, and also has $0 prescription copays. And dental coverage, it's $1,000 in first dollar dental coverage. For vision coverage, it's $300 per year. And for hearing aids per year, again, $1,100. The post-discharge meals benefit is still the same, 28 meals to cover 14 days for an unlimited number of times per year. This plan also has the $50 per month in healthy food, over the counter, or utility cost. And again, is a tremendous help to our D-SNP population, those that have the partial Medicaid benefit. This plan also includes, it's one of the few that do, this plan includes the Flex card. And it's a $300 benefit for copays if they need to pay copays for dental, vision, or hearing. And there's also 24 one-way trips to approved locations, as well as the Medicaid reimbursement, as I mentioned earlier, for buses, Ubers, mileage reimbursement for family. All right, so I want to talk a little bit about the resources that we have available for all of you now that we've covered some of the plans. So we have tremendous marketing support, and the UnitedHealthcare Agent Toolkit, again, as I mentioned earlier, has a tremendous amount of materials for you. We offer targeted materials, which includes member marketing, provider marketing, event materials. There's a D-SNP section on the UnitedHealthcare Toolkit. Most items can be co-branded with an agent name, your contact information, even a headshot picture. Many of the D-SNP materials on the toolkit are at no cost to you. So again, it's worth your time to go in and explore and see what's available for you there. Also, you can access the D-SNP materials flyer to quickly find D-SNP specific marketing materials in the toolkit. And again, a lot of these materials are customizable and they're free. Or if they're not free, they're very, very low cost. So please make sure and check all of that out. We have learned that agents that use the UnitedHealthcare Toolkit normally write about double the amount of apps than those who do not use it. That's substantial. So again, they write about double the number of apps than those that do not use the toolkit. So please make sure that you utilize that for your benefit, and it will help your members as well. And next, I also want to share them with you some of our outreach strategies where you can use the materials in the toolkit to help your D-SNP consumers and members. And again, kind of focusing on that, but also even regular MA members. So to address the concerns of selling to the dual SNP population, you need to stay in touch with them, especially the new members. That will definitely help with your member retention. You want to thank your members for choosing or staying with their plan by calling, sending them a thank you card or a relationship letter. You can also share wellness information with members by taking advantage of newsletters that are in the toolkit. And again, all of this is customizable, where your name, your picture, everything is on there. It's tremendous information. You can also get a business card magnet customized for free that they can put on their fridge in case they have questions. I like to share with other people that, my wife and I, we've got grandchildren, 6 grandchildren. So, on the side of our refrigerator, we've got all kinds of their pictures and their sports activities. We got everything up there with our refrigerator magnets on the side. Well, the population that we serve, they do the same thing. So you can get these business card magnets, they need them to hold their stuff up on their fridge. And every time they look at that magnet, it's your information, and it's free. It's just like a business card, and it's totally free. So you really ought to go in there and do that. All right. You can also help improve member retention by reaching out to the member, inquire if they have any questions, take the opportunity to support them, help walk them through the different benefits they have with their plans. Some additional best practices to follow, in addition to conducting these member touch points. Take notes about what you discuss with your members. Track any questions from the member and get back to them quickly. Also establish with the member a good time to call them back, to follow up. So those little touch points make a world of difference with your members, and it helps them to stay with you because then they trust you, and you have to build that trustworthy relationship, as I'm sure most of you know. So at this point, I'm going to turn it back over to Erin, and she's going to finish up these last few slides for us. Erin?
Thanks, Andy. I know we saved the best for last with some of those tips and tricks and all of the things we can do to help support you in this, because we know you want to build your book of business and then maintain that. And we can help you do that with all of those great pieces on the UnitedHealthcare Agent Toolkit. So if you're not already appointed with UnitedHealthcare, we would love to have you and show you all of those fantastic compliant pieces. Like Andy said, people who use the toolkit do end up giving more business. We just have so much we can do there. We can help you with the campaigns, and I know URL can as well. There's all kinds of marketing campaigns, both with regular mail. We don't forget about that. That still does get a response. And then we also have a lot of social media materials on the Agent Toolkit, which that's where a lot of folks are on social media now. We have a lot of great compliant posts you can use too, and tips on how often to post, how to engage there. We have a lot of great lead vendors we work with and URL works with to help you develop a strategy online and in your own community. So next steps, we hope you reach out to URL, to the great folks there, to us. We would love to talk with you more on how we can help you build your business wherever you are in Eastern Pennsylvania or Delaware. We have so much support for you, both with the local market managers like myself and Andy, Julie, and Miriam and Terry. We also have a lot of self-guided learning, which I wanted to just point out to our folks who are with UnitedHealthcare already. Don't forget about the Learning Lab, another thing to do to make yourself valuable to your clients and build loyalty, like Andy said, is trust. And they're trusting you to be an expert in your industry, and we can help you with that with all of our self-guided courses on the Learning Lab. I pulled out one there for the dual special needs. If you are going to sell the dual special needs plans, there is an extra certification for that, but there's so much other learning on the Learning Lab, all kinds of videos, guides. There are resources on there where you can pull off a PDF and download most of our information for you to have as a desk reference. Lots of great stuff there. For anyone that is already appointed with UnitedHealthcare and wants to know even more, where I got some of these information for some of these slides, if you go to uhcjarvis.com, you would go to the Knowledge Center. And at the Knowledge Center, there is so much there. One of the places you can go to pull some information is the Knowledge Center, and then Product Overview. That will show you those slides that I had with all of those information that's side by side. That's the product overview. You can also go to our enrollment guides and pull the sales materials enrollment guides for the entire portfolio. And that is with the sales materials portal. Again, Knowledge Center, or I'm sorry, sales materials portal. And then you go to order, and you will see a lot of information there. All of that is free to order on the sales materials portal. Our enrollment guides for the whole portfolio, the dual special needs, the Medicare Advantage, and the Medicare supplement. And we can now, if you have any other questions, we can answer them now. I know there was one question, and I know that's a common one, so I will say it for anyone listening on the recording, if you didn't see the chat, we get this question a lot about our collaboration with AARP and how does that differ at all across the portfolio, which AARP exclusively endorses UnitedHealthcare's Medicare plans, our Medicare Supplement, Medicare Advantage plans. We're the only carrier to carry that brand endorsement. And the one difference between the supplements and the Medicare Advantage is that we do have the requirement that a person who enrolls for the first time in the AARP Medicare Supplement Plan must be an active member of AARP, the discount organization with the red card, the discount card that gets all sorts of great dining, entertainment discounts. They do need to have an active AARP membership to enroll in a Medicare Supplement Plan for the first time. They don't have to keep that membership. They can let it drop, but many people end up keeping it for all of those great discounts and rewards. On the Medicare Advantage portfolio side, that is not a requirement. They do not have to have an active AARP membership number because that does not tie to the ID at all on the Medicare Advantage side. But turns out many of our Medicare Advantage members already are AARP members anyways. But just wanted to point that out because it is a question we get a lot. Does anyone else see any other questions in the chat? I don't think so.
Erin, that was the main one, and I appreciate you clarifying that. I was incorrect with my initial answer about that, but yeah, that what you said is correct there. Just they have to have that AARP member number to sign up for Med Sups only, but they don't have to keep that coverage if they don't want to.
Correct.
So thank you for bringing that out.
Sure. And if URL, if Christy's still on, did you want to say anything before we did great with time.
You did
Applause to everyone
wonderful
there.
with time. Yeah, it was a great presentation. Thank you to all of you for making time to be on with us today. And have a good rest of your day. We appreciate your partnership.
Thank you.
Thank you, everyone.
Thank you, everyone.
Have a